As I said, I'm Natalie Peters. I'm a journalist. I'm the news director at Nine's radio newsroom here in Sydney. I've read tens of thousands of news bulletins with the word COVID in them. It's been a long 2 years. I was an early adapter. I tested positive in March 2020. I did 23 days isolation back then. That was the policy in a one-bedroom unit with no balcony. But I'm actually in awe of all of you and the health workers who've helped and worked so hard during the pandemic to keep the community and each other safe, but also together, which is what we're here to celebrate today. It's day one of the Sydney Innovation and Research Symposium, and we start this very special event for Sydney Local Health District with the Care in Our Community Forum. It's pretty amazing that we're all here together, almost 2.5 years since we first heard that word COVID, coronavirus at the start, of course. And for the very first time, thanks to some of the lessons that we've learnt during the pandemic, we have a hybrid event. So we have a lot of people watching online. Thank you so much for being here as well. We'd like to welcome everyone joining us virtually and also here. The symposium began 10 years ago. It was a matchmaking idea by Chief Executive Dr. Teresa Anderson. And all these years later, we know it as Innovation Week. And this year, the theme, as you just saw, connection, collaboration, and dreaming big for a bright future. And we're going to hear some of those dreams today from you here in this room. I want you to think about that, even if you're not going to be up here on the stage. What is your message of hope for the future as we emerge from these bizarre 2 years? You can join the conversation at slido.com and just use the hashtag community. We want you to hear and experience the stories of our communities, of our patients, and of our partnerships, and of course the staff of Sydney Local Health District. But first, I would like to welcome a very special guest, Brendan Kerrin from the Metropolitan Local Aboriginal Land Council, to welcome us all to country. Brendan.
Thank you. I've just realised that there's a few familiar faces that I've seen over the last couple of days. And you've heard my story, most of you here. So welcome and see you later. My story very briefly. The part of the stolen generation, born in 1971 at Crown Street Women's Hospital. That's the last time I ever felt my mother's touch from that hospital in Surrey Hills. I'm one of 10 siblings that have been removed, and I'm the second generation of my family to be taken as well. And I share just a little bit of this story. If we have a look at that history of when Cook landed and that invasion, which for Aboriginal people is ground zero for us, and it happened not far from here, just down the road. In less than 50 years of that invasion, 80% of Aboriginal people and culture was wiped out on the East Coast. Now, if we fast forward that timeline, we had an era in the times of massacres. There's 500 people, family members of mine, that were slaughtered over water. Women, children and men, just over water. And my story is very much similar to a lot of Aboriginal people. We had that whole era of stolen generation. I was taken in 71. We're still the highest rate of removal for our children in this country. We're the highest rate of incarceration in this country. We've got third world conditions in some of our communities. And look, I share this story for when you have a welcome to country, I ask you to have that bit of reflection time of what my people have been through to get to where we are today. Because 10 years ago, we'd never have had a welcome to country or an acknowledgement of country. And this being Reconciliation Week, and the other day, last week, was Sorry Day. I've been asked nearly every day, what does Reconciliation Week mean for me? I feel personally, I feel as though what do I need to reconcile for? I'd rather what was taken just be given back. There's not everything I'm going to be able to get back, but it takes two to reconcile. And I've heard, Reconciliation Week, how many times every year We've had Reconciliation Week, and as far as I'm concerned, nothing has changed for us. We're getting there. There is a movement. I'm here, for starters. As I said 10 years ago, we'd never have had a welcome to country or an acknowledgement of country. And I'm not going to share the joke was 10 years ago you'd never have had a welcome to country by such a good-looking bloke as myself. So for me, it's always an honour and a privilege to welcome people to country. The country that we're on this morning is Gadigal country. And Gadigal is one of 29 clans which make up the Eora Nation. And the boundaries for the Eora Nation start from the ocean, and they're surrounded and hugged by three of Australia's most beautiful rivers: the Nepean River, the Georges River, and the Hawkesbury River. And in between those three mighty and beautiful rivers, we've got 29 clans which make up the Eora Nation. And the name of the clan we're gathered on here today is Gadigal. Aboriginal people are the world's oldest living culture. The world's oldest living culture. We've been here for over 250,000 years BC. And the BC stands for before Cook. So once again, I'd like to welcome everyone here to Gadigal country. And just on that reconciliation, if there's anyone here that, I'm quite open for this, that wants to have a little bit of reconciliation with me personally, I'm parked just across the road at Wilson Car Park. I'm quite happy for you to pay for that parking ticket, and I'll accept that as your reconciliation part done. So once again, welcome to Gadigal country. Thank you for having me here yet again, for some of you. I'll be seeing some of you, if not all of you, again tomorrow, so sucked in. You get the same story again. I hope you're looking forward to it just as much as I am. But once again, welcome. Thank you for having me. Thanks.
Thank you, Brendan, for your welcome and for sharing this important message of reconciliation. As you said, Reconciliation Week, and to think we still have the highest rate of removal. There's a lot for all of us to think about there. We will be hearing from many of you today about how you care for your communities. It's an opportunity to look back at the extraordinary way that you cared for communities in these extraordinary times, but it's also a chance to look forward, and that's really important today, to bring together all of those experiences and ideas to help shape the future. Today is a conversation. It's about collaboration, connection, and it's a chance to talk about why collaboration and connection are so important in healthcare. And we want you to leave here inspired, to take the lessons and the conversations back to where you work, to your colleagues, to continue the conversation. And so welcome to this part of a very special week. Thank you for your enthusiasm in advance for this event and for being here today. On the housekeeping front, we are live streaming, we're filming, we're taking photographs, and they will be published by New South Wales Health. In the event of an emergency, follow the instructions of Hyatt staff, also exit signs around. In the event of a toilet emergency, that way, across the walkway that you came in on. We encourage all our guests to wear face masks to support this COVID-safe event. So masks on if you like, mobile phone ringtones off, please. And hopefully that will be the rest of the housekeeping for the day. I'd like to acknowledge our special guests and speakers today. We have quite a few health staff who'll be presenting, as well as community experts, members of the community who have agreed to be part of the program in some way, and also all of those who are joining us online. First up, I'd like to acknowledge the District's Chief Executive, Dr. Teresa Anderson, and we'll hear from her in just a moment. Unfortunately, the Minister for Health, the Honourable Brad Hazzard, has been unable to attend this morning. The Chair of the Board, the Honourable John Ajaka, who we'll hear from shortly, Board Member Richard Atchison, who I will not point out down the back there. Thank you, Richard. The Head of Clinical Services Integration and Population Health, Luann Blunden, and our other executive and board members. In particular, Renee Morton, General Manager of Population Health, and Lisa Parsi, Director Integration and Partnerships, who have been instrumental in putting today's program together. I'd also like to acknowledge all the managers and staff that work on those individual programs. And of course, days like today are not possible without our sponsors. If you wouldn't mind casting an eye up there to see all of those people who are supporting our work. I'd now like to welcome the Chair of the Board, the Honourable John Ajaka, to officially open the Sydney Innovation and Research Symposium for 2022.
Firstly, can I thank Brendan for his, as usual, brilliant and wonderful welcome to country, and can I also begin by acknowledging the traditional owners of the land, the Gadigal people of the Eora Nation, and pay my respects to elders past and present, and all Aboriginal people joining us today. Can I take this opportunity to also thank Natalie Peters for agreeing to do this and for all that you're going to do over the next couple of days. Thank you, Natalie. I'm pleased to be here today to officially open the Sydney Local Health District Sydney Innovation and Research Symposium. In particular, this session, the Care in Our Community Forum. I'd like to acknowledge Minister Brad Hazzard, who was of course meant to be here to open this symposium. I spoke to him about 30 minutes ago on the phone. I can assure you he's ill. And he regrets terribly that he's not here, and he was looking forward to being with you today. I knew that he was incredibly ill because he said to me, "John, I have to go. I'm finding it very difficult to talk." Those of you that know Minister Hazzard, it's astonishing how ill he must be if he finds it difficult to talk to you. Can also acknowledge Dr. Teresa Anderson, the Chief Executive, who of course is at home with COVID. Can also acknowledge my board members, Professor Christine Giles. Christine, if you'd like to wave. Christine is the Deputy Chair of the district. And we also have Richard, Richard sitting way at the... Richard always loves to sit at the back. Thank you, Richard. Can I acknowledge Luanne Blunden, the Executive Director, Clinical Services and Population Health as well. And can I acknowledge all the community members here today and the special guests from community and partner organisations. And can I also acknowledge the staff of Sydney Local Health District who work in our communities every single day. Now, Minister Hazzard gave me one instruction. He told me not to read the speech. So I promised not to read the 300 pages that were provided to me in this folder, but just to simply say a few things. On behalf of the Minister, Teresa Anderson, myself and all the board members, can I thank you all for the incredible job that you've been undertaking, the incredible job that was done through one of the hardest times that I'm aware of during the COVID crisis. Not only all of the Sydney Local Health staff, not just the medical staff, but all other staff of the district, as well as all of the community members who gave their time, effort and energy to help us during this period. When I was a minister, my favourite saying was that government can't do it on its own. Government needs to be working with members of the community, need to be working with the bureaucrats, need to be working with the staff. It takes organisations, one and all, working in synergy together. Well, COVID proved exactly that. COVID proved that there was no way we in New South Wales would get through it if we did not come together and work as one. And I congratulate each and every one of you because you proved firsthand that by coming together and working as one, we got through that incredibly difficult period. We're here today with the main theme of innovation. And can I tell you, we would not have gotten through COVID if it wasn't for some of the wonderful innovation that had occurred prior to the pandemic. And if I can give you one really fabulous example, RPA Virtual. Set up before there was any thought of a pandemic coming along. And didn't that prove to be an absolute godsend for us? I know it firsthand because I'm a patient of RPA Virtual. I got COVID of all days on Christmas Day, followed by my wife, followed by my two daughters. All of us in the one household with COVID. And if it wasn't for RPA Virtual ringing us almost each day to check up on us and giving us an opportunity to ring them when we had questions, it would have been a very, very difficult Christmas for us. So innovation is the way forward. And what you're going to hear and what you see outside will help answer many of those questions. So on that note, thank you all for being here. On that note, I hope you have a great symposium. And again, thank you for everything you do, and I know you will continue to do for our people in New South Wales. Thank you.
The Chair of the Board, the Honourable John Ajaka, thank you so much for that. And of course, nice to hear more well-earned congratulations for all of you who came together and worked together to get us through this. So now to the first part of our Innovation Week conversation. This morning is really an opportunity to reflect on the response to the pandemic in Sydney Local Health District and what it's taught us about navigating healthcare in partnership with communities. The questions are, and these are for you as well, we're going to answer these online. What did you learn during the COVID-19 response? And this is my favourite, can't wait for the answers on this one. What did you do that you never thought you would do, other than wearing full PPE for 2 years? You can join the conversation at any time, slido.com. You can have a look on your phone, #community. We're going to hear your online contributions shortly, so please do contribute, especially those at home. The questions again, what did you learn during the COVID response? And what did you do that you never thought you would do? Let's take a look at this video.
One thing I did during COVID that I never thought I would do was be part of the pop-up vaccination clinic. You know, it was really interesting to see, you know, a wide variety of Sydney Local Health District staff, you know, health professionals and other professionals come and be able to deliver the vaccination clinic out of our community centre.
I visited 130 boarding houses with my colleagues. We COVID tested lots of residents and we talked to up to 1,000 residents about their well-being.
To work in collaboration with key services, including RPA Virtual, Public Health Unit and COVID vaccination clinics.
I also provided food security to Aboriginal and Torres Strait Islander people who are isolating in community.
What we achieved by working together to support people navigate COVID was to re-establish the trust amongst community around taking the vaccine, where we're able to send a strong message to all community that we are all in this together and the only way out of this pandemic is for us to stay safe and get vaccinated.
Improving my Mandarin in Australia, which my mother is so happy about,
was to pair an infection prevention and control practitioner with a social worker to support our vulnerable communities.
The collaboration between the Sydney Local Health District, local health professionals, community organisations, multicultural workers and local MPs empowered the community to make informed decisions and be supported during a very challenging period.
Rostering about 100 culture support workers to different mobile vaccination centres and the Sydney Olympic Park Vaccination Centre.
Well, I enjoyed it very much because we were staff from all around Sydney working in New South Wales Health, and we had very good teamwork.
It got to the point we were calling so many ambulances every day that when I'd ring up for an emergency ambulance, they would say, "Oh, hey, Michaela, it's you again." And we got a really good understanding of each other's working roles.
I never thought I would be trying to locate people's luggage across different hotels and different airlines.
Well, I actually started using telehealth for the first time during the COVID pandemic. At first I found it quite challenging to adapt my traditional assessments and therapies to do over telehealth, but we learned to very quickly adapt and upskill, and it was quite an enjoyable experience.
Work with special health accommodation to assist people into hotel quarantine.
Must admit I also got pretty good at making beds. I think my grandma would be quite proud of my hospital corners.
So I picked up hula hooping, I was doing online classes. It was pretty fun and kept me quite active.
To be greeted by hundreds of people queuing along the pathways, many of whom had clearly been there half the night, all desperately trying to get vaccinated for COVID-19.
At the peak of the pandemic, we had 3 health hotels with over 1,000 patients who isolated within an apartment complex or multiple complexes, and we managed their care.
Going into day centres to help set up pop-up vaccination clinics so that people with disabilities and their carers are able to get their COVID vaccine without the stress and hassle.
Wearing full PPE with an N95 mask back-to-back clients in the Canterbury region. I remember several times sweating so much that my gloves were dripping when I pulled them off.
Everyone that knows how those masks work knows that this wasn't going to cut the mustard. So I had to buy a whole bunch of toiletries that I haven't had to since I was a teenager.
Visiting the shops in different suburbs in our district, talk to the shop owners and encourage them to get vaccinated. And what made it work was people from CALD backgrounds felt more comfortable coming to the pop-up clinics because we speak their language.
Can we get a round of applause for everyone who was on the video? Is anyone, stand up please, anyone on that video in the room here today? Just so we can give you a proper round of applause. There we go. How many staff did you roster? 100. Nightmare, absolute nightmare. Now, I was hoping to introduce Dr. Teresa Anderson to the conversation, but as you heard, the Chief Executive is at home with COVID. She isn't able to be here, but she has sent a message, and I'll read that to you now. Good morning, everyone. I've been looking forward to Innovation Week for quite some time. This is the first time since the start of the pandemic that we've been able to hold an event like this one that celebrates connection, collaboration, and dreaming big for a bright future. Very few things could keep me from Sydney Local Health District's Innovation Week. As you know, it's my favourite week of the year. And so it will come as no surprise to you that one of the few things that would keep me away would be the very thing we've all been working so hard to fight for the last few years, COVID. Teresa says, I'm so disappointed that I can't be there in person. But I'd like to take this opportunity to thank you all for what you've done for our communities during our COVID response. We were stronger together. Together, we did whatever we could to keep the community safe. We cared for one another, we found solutions, and we were kind. Teresa says, I think that kindness, that real sense of being able to do something that helps someone else, that's what drove us every day, even at the hardest of times. And eventually we saw a change. Have a great care in our community forum. So those were the words of Dr. Teresa Anderson. Teresa, we know you're watching online, and from the whole team here at Sydney Local Health District, we really do wish you a very speedy recovery, and we wish you were here. Now, I want to dive into the nitty-gritty of how you all responded to the COVID crisis, and I'm going to have some help to do that from a lot of people here today. First up are some members of our Canterbury community who were instrumental in the Sydney Local Health District response. We have our community leader, Ahmed Malis, Dr. Fariha Dib, who is a GP in the Lakemba community, and also Khaled Kamalmaz from the Lebanese Muslim Association. Now, Ahmed, perhaps we could start with you. What was happening in the community at the time that you were setting up the vaccination clinic at, I believe it was at the Lebanese Muslim Association in Lakemba? Can you explain what it was like working with the district at that moment?
Yep, so the time then was very, very different. As we know, the Delta outbreak had just started, the number of cases were increasing, and the community was suffering, and there was a political move being played where the community was blamed for a lot of the COVID numbers being increasing. And we saw the heavy-handed approach the police took as well when we saw, the army coming in. So obviously that type of context provided the community, a lot of reason for them to be quite frustrated and upset. So with a lot of, adding to that, a lot of misinformation, the voice of the anti-vaxxers were very loud, and we needed a solution, and hence the, establishing the community COVID clinic was was the only way we thought we can re-engage the community. So, the idea came about, we delivered the clinic, and obviously the district was instrumental in making that happen, knowing that we were going to get a lot of backlash, and criticism for delivering the clinic. What it did when we started was, on the first day the criticism was very high, but we found on the second and third and the subsequent clinics was that people were starting to accept the idea. So it became a communal drive to get vaccinated, and people started to feel less of a burden in coming to get the vaccine. So we kind of shared the load. Obviously it was very challenging, limited resources and the schedules working across, but with the district that were very accommodating, very understanding, and ensuring that the cultural needs of the community are being met. So we're able to leverage a lot of the very strong synergies that we have between the community as well as the health. So the community were very willing to accommodate, for example, for things like providing private rooms for females to come and get the vaccine, providing signages in language, in Arabic and Urdu and other languages. and working together, on the ground, traversing the queues and speaking to people and convincing them about taking the vaccine, especially when Pfizer had run out. We saw an uproar in the community, and a lot of people who today, like Renee, Luann, and the team obviously with us, were there on the ground and talking to every single one person. We're having the really hard conversations, and people were shouting. So it was a very interesting kind of environment. But together, I think with this kind of unique approach, it really helped to deliver something that was missing at the time. We overcome all the politics and delivered something on the ground. I think that sent a really strong message to community that we're all in this together, and it's only by coming together and actually taking action that we can get out of the pandemic.
Talk about being on the front line, literally out there in the crowds. Faria, how important was it for you to actually be involved in these community vaccination clinics as a local GP who no doubt knew a lot of the people who were in those crowds?
Yeah, absolutely. I did know a lot of the people that were waiting in line to be vaccinated. Look, my role was only one integral piece of the puzzle. As Ahmed mentioned, it was the collaboration between the Sydney Local Health District and the local health professionals like myself, the community organisation, the multicultural health workers, the interpreters. It was a collective effort, and it was all about identifying those key personnel and community organisations, bringing them together, and the biggest thing was gaining the trust of the community. At the beginning of the vaccine rollout and at the beginning of the pandemic, there was unprecedented amount of medical misinformation, as you're all aware. And it was good to have that opportunity just to be at the forefront. We were on the street just addressing people's concerns, debunking some of the conspiracy theories. And what we found out very quickly is that it was just a disconnect between the health messages coming through and the community. And once you're able to speak to them, a lot of the community members were very happy to be vaccinated. Probably one of the more challenging times was at the beginning where we did have a shortage of the Pfizer vaccine, and we were counselling people as to why it was important to have the vaccine that was readily available, and at that time it was the AstraZeneca vaccine. We didn't have any help from the media, who were sensationalising, and the way they were communicating the very rare side effect of TTS, unfortunately, didn't help. But as Ahmed said, a lot of people were willing to get vaccinated, and the clinic was pivotal in increasing the rates of vaccination in the areas that were very much areas of concern during the majority of the Delta wave, the Canterbury and Bankstown LGAs.
Wonderful. They're so lucky to have you to bridge that gap. Now, Khaled, from your perspective as a staff member at the Lebanese Muslim Association, what was achieved by working together with Sydney Local Health District to support the community that we've just heard about that had so many concerns in those early days?
Yep. I think at the start it was just it was really surreal. So a lot of the community didn't really know, what was taking place at these vaccination centres. They didn't know what to expect. They didn't know where to go initially. And just to have Sydney Local Health District, come in and transform the space to a vaccination centre within such a short time frame. I recall it was, they spoke about it in a week, and within a day someone had come down, taken a look, and within the next week it was up and running. So a lot of people were able to actually get a much better understanding of what was taking place, the amount of effort, the amount of people behind the whole operation, and that generated a lot of appreciation for the healthcare workers and for the health district. And once even us as employees, once we were able to see just how much is going on, we were relaying that onto other people, family members, community members. They were relaying it onto others, that the local health district is out here to support you. And that's when we saw, a large number of people actually coming in, very surprised to see, the health district, at the community centre, right next to the mosque, which is very integral to our community. So yeah, that was the most, working together was amazing. And it also allowed, I think another very important bit is the community members to get a better understanding of the health system. So not a lot of people knew what local health districts were within our community. But after they came into the clinic and we told them that, Sydney Local Health District is offering it, and then we discussed, other services that they offer also, I think that was also very pivotal.
Wonderful. Ahmad, Fariha and Khaled, thank you so much for your time and for all that you've done in your community. Now let's move along a little bit. We've heard what it was like for the community in Canterbury, in the Canterbury LGA, at that time in the pandemic early on. And now we want to talk to some of the staff who formed those teams setting up the mobile vaccination services working in the community. We've got some great photos of our stars up there. Sarah Fletcher is the Safety Culture Coordinator at RPA Hospital. Chi Chi, Director of Priority Population Programs and a bit of a rock star from what I've heard. Barbara Luisi, Director of the Diversity Hub, and Yasmin Fatima, who is a cultural support worker in Sydney Local Health District, but also from the Burmese Rohingya community, so played a really important role communicating with other members of her community. Now, Sarah, you had an instrumental role in really activating those ideas that were formed in the community. Tell me a bit about what was involved in setting up these mobile vaccination clinics. It kind of sounds like you had an army of nurses out on the go.
Thanks, Natalie. I'd also like to confirm that she is definitely a rock star. So initially, I was asked to do some mobile vaccination clinics, but they were very small, of a small scale, so we're just doing them here and there. So we would do disability day centres, dementia day centres, some vulnerable communities, drug rehab, things like that. And then when the Delta outbreak happened, the mobile vaccination clinics gathered quite a lot of steam in quite a small amount of time. And so that's when we really started to collaborate together as a community. So it wasn't just nurses on the ground. It was, I'm certainly going to forget some people here, but vaccination workers, our medical staff, our pharmacy teams, our strategic relations community, our engineering, security, traffic management, and as well supported by a really great management team. And so it just became this, like, to say that there was a lot of plates spinning is really an understatement, and it was like this amazing logistical feat that everyone just got in, put their hat on, threw it in the ring, and then just made it happen. And so what we would do is we would meet regularly, review our processes, and then we would collaborate with our community members as well to make sure that everyone was on board. One of the things that did really help was that we would go consistently to certain vaccination clinics during the outbreak. So we could go back and look at flow, then we could re-establish what we were doing, regaining that trust in the community. So it certainly wasn't without its challenges. And like these guys said, some of the challenges were definitely vaccine eligibility and availability, as well as our staff having to communicate to a culturally and linguistically diverse community. And also when there was a lot of fear and uncertainty during an outbreak, LGA lockdowns. And so it just was actually quite a frightening time for everyone. But it was amazing. Like, it was unreal. Like, we met people that we wouldn't necessarily normally have met. And that was amazing. Like, and we just worked in this environment, and to have such an impact on the community was extraordinarily rewarding. And so for me, the biggest learnings would have been things like time and patience, and really gaining that trust, like you guys said, gaining that trust in our communities. And then just understanding the resources that need to go in there, our cultural support workers, interpreters, the resources that were developed tangibly to give to people, to make sure that the message that we gave was that right balance of trust, as well as ensuring healthcare and educating and supporting and reassuring. And so I certainly felt like a very small drop in a very big pool of extraordinary people, but I think that we did a really great job.
It sounds like a logistical nightmare turned into a logistical feat. This is incredible. Now, Chi, we've got some great photos of you up here, buying flowers for your mum.
Yeah.
Sort of. Out and about, communicating with people in the community. You took on so many roles. Can you tell us about what you did, and of course why language was so important, communicating with your community? As we heard, your mum was very impressed that your Mandarin skills did this during the pandemic.
I still remember that photo with the group of the Chinese community members. I was explaining to them what's going to happen in the vaccination clinic, especially at the time. There's just so much confusion, and then also question about the eligibility of the Pfizer and as well as AstraZeneca. And then I remember I showed that to my mom. I said, "What are you doing in Australia? I thought you were office-based. But I agree with what people were saying earlier. I think it's really provide that opportunity to engage with the community. In that case, we did, as I say, there's so much misinformation, at the time. So what we're trying to do is very hard to making sure the community is actually better understands what's going on. That could be COVID safety measures, it could be the restrictions, and then in this case, for example, vaccines. And then I think the language, by speaking their own language, really break that ice and then really get that trust. And then also I think trust is probably something that's already been mentioned several times. But something we did very different as well is that patient journey. So we were there every step of the way, from the time they arrive until the time they finish their vaccine. That's including vaccination records. I think the people really appreciate. I think that for me is that during the process, we're supporting them, helping them answer the questions and troubleshooting, and then we learn so much back from them, telling us their needs, telling us what we can improve our services. I think that organic partnership formed so nicely and then so naturally as well. And I still remember, especially that photo is taken in Kempsey. Kempsey is dear in my heart. The residents there, they're so wonderful and beautiful. I still remember I got roast chicken lunch or something when I went. They thanked me to help them to get the family vaccinated. But in a sense, as I say, it's just so beautiful in terms of what we do and then get a return from the community.
And it's incredible how you evolved and had to change your processes on the go and learn so much. I want to know, what was something you did that you thought you would never do?
Apart from learning Mandarin, I'm actually colorblind, and I never thought I'm going to be administrating, developing color-coded roster for contact tracers team. With my dear colleague Barbara.
Poor Barbara here is having flashbacks.
We have a song of a funny moments, believe me. And I said, are you sure? I'm sure. That's another thing I never thought I would do.
Chi, thank you so much for all your work.
Pleasure.
There was also less visible, really crucial work happening at the time in the CALD community. Barbara, tell us about the cultural and language support. We've heard so much about how important it is, but how was it like for people with COVID and in isolation when you really had to find those support measures?
Yeah, so certainly, I mean, obviously there was a lot of support happening in the vaccination clinics, but at the other end of the spectrum, there was a lot of work that actually went into working very closely with my colleagues at the Public Health Unit, particularly around contact tracing, and there was a trickiness around that because, of course, the approach was certainly a government-led approach, and for some of our communities that is actually quite problematic, and particularly for some communities from refugee and asylum seeker backgrounds, it brings up a lot of trauma. And so being able to provide contact tracing in language to bridge that gap and to really sort of assist people in understanding the importance of contact tracing, not just for them but for the community, and that while they might have had to isolate, we would be there to look after them. These were people in highly precarious and highly casualised roles with no job security and no income if they weren't able to work. So overcoming some of those natural sort of, fears was really important. And so that took a lot of work, and I think being able to do that in language and understanding the cultural nuances around that was fundamental. And then beyond that, actually encouraging people to enter into special health accommodation. Again, some of the members of our more vulnerable communities live in multifamily households where it was impossible to isolate. And so, again, overcoming some of those misconceptions around special health accommodation and what that meant from, quite sort of mundane issues around explaining that they wouldn't have to pay, right through to, explaining that if they did go into special health accommodation, it wouldn't mean that they would then end up in a detention centre because perhaps they didn't have the appropriate visas. It was really about their health. And then wrapping that around and ensuring that, the communities that were members of the community that were either isolating at home or in special health accommodation, continuing to perform welfare checks, contacting them every day, ensuring that they were okay, that they had enough food, doing the food deliveries, and just checking in on them. So really making sure that they felt that they were being looked after. And I think that was something that I learnt, because whilst the cogs of the machine were turning and there were these really, it was a really big sort of picture moment where we had to look after huge communities. The individuals never got left behind either, and their needs were looked after, and that was really, I think, for me, a fundamental, and that everyone understood that each person mattered and needed to be reassured and looked after. And of course, I think I'm echoing the theme that has come through, was all about trust and really developing that trust.
Yeah, trust and truth-telling seem to be what's coming through. Barbara, thank you. It would have been wonderful to get the call from someone in your team after the door knock from police, because it was really scary, and I'm not from a marginalised community, but having police knock on your door was really intimidating. So to have someone call, speak in your language, would have just taken some of the fear out of that. Yasmin, you were involved in providing support to members of your community who needed to isolate or enter quarantine because they had COVID. Or they were close contacts at that time, so of course we were much stricter back then. Tell us what that time was like for your community and how you went about supporting them.
Thank you. The situation of my community around that time, you can imagine that they were frightened, living panic, stress. You can imagine that coming from Burma, they just escaped something and they come through something else now. At the same time, they were grateful, actually. They are very supportive. And I have been working around that time with almost everyone, from child to a man to a woman who is pregnant. So generally at that time, most of the men were working casually. Then we have families with wife, with husbands who is having some medical issues already, and who is living in shared accommodation, like one house with 10 people, and all of them having COVID, need to isolate. So they were living in fear at that time because they can't go outside to get help as well because they have to stay at home. And at that time I was on the phone. I helped so many people through my work, but particularly two cases or stories stuck in my head was the women who, her husband was positive with COVID, and he also had some medical issues. He needed to isolate because she was pregnant at that time, just very close to deliver, and then because of the language barrier they had, the difficulty they had, and miscommunication initially has created more fear within themselves, and the husband said, no, I'm not going to go to hotel quarantine, I'm going to stay here and die at home with my wife. That time, with the language I help them and then clarify them what is happening, because the miscommunication they receive is that the wife will end up with cesarean section. Usually, she already has some children like with normal delivery, so she was so scared. She said, I'm going to just deliver at home. I'm not going to go hospital. So at that time, I helped them with the clarification, with the help of the doctors, nurses who was on the phone with me. And finally, the husband went to the hotel quarantine. She was at home. We were working with her 24 hours. Actually, I was on the phone 24 hours in case she might deliver at any time. And then, she delivered safely. They were happy in the end. And they were actually really grateful that these services was available. And another case I can remember was a man who is living in the share house with 7 other men, I believe. Most of them got COVID, and they need to isolate because they were living in 3-bedroom house, sharing bedroom. So 3 have to go outside, 3 have to stay home because the bathroom also limited. And at that time, there was one man who had problem with his vision. He got and then he was stuck at home because he needed to isolate at home. And he is working casually. He got his wife back in refugee camp in Bangladesh. He needed to send money. Now he can't work. He lost income because he said he's casual. He go to work, so he get paid not going to work, he doesn't get paid. And then the owner of the house also chasing him for the rent at the same time, and he doesn't know how to apply for the payment. I can't help him because he doesn't know how to go on to Zoom meeting. Everything was on the phone. And then it was 3 days or 2 days, I think. Even my weekend, I took time with him because I need to help him to get through MyGov, to get this PIN, this and that. And I can remember that, like MyGov sending a code to his phone. And then he have problem with his vision.
Oh, no.
And now I have difficulty to direct him how to zoom his phone, you know. So, so through the phone, I said, go to this button, zoom, you know. I don't know. He managed to get that PIN for me. He read it to me, and then I can help him with his payment. And that's some of the example. But in the end, my community, they are really grateful. They are very supportive. They are always there. Whatever like we deliver to them through our communication, they're always there, and then they support. And then, my community would like to say thank you for all the help were provided to them during that time. Yeah, thank you.
Incredible. In Teresa's speech before that I read out, she mentioned that you care. I mean, come on, that was incredible, you know, on a micro level. And I don't know if they used your name as the middle name for the baby, but maybe they should have. Little Yasmin. So thank you all. And let's just remember, for those in the audience here, but also those watching at home, we want to hear from you as well. Those two questions: what did you learn during the COVID response? But also, what did you do that you never thought you would do? You can join the conversation anytime. Just head to slido.com with the #community. Now, one of the other significant parts of the strategy behind the response to COVID was the establishment of the Aboriginal Cultural Support Team. And we have a great group here to talk about that. Carinya Belair is the Acting Manager of the Executive Support Unit. Walter Towney is the Acting Director of Performance, Reporting and Clinical Services Support at RPA Virtual. Big shout out to you earlier. Congratulations for getting that up beforehand, of course. Alexis Joseph, Aboriginal Cultural Support Navigator, also at RPA Virtual Hospital. And Athena Mumbala, who is a Senior Aboriginal Health Worker with Priority Populations Programs. Carinya, starting with you first, you have deep ties with the local community. You're probably in a really good place to explain to us what some of those early difficulties were and the fears in the Aboriginal community.
I think...
I don't know if that's on. Let me have a quick... Give that a go.
Blame Renee for that.
No. Yeah, maybe speak up.
There you go.
Yeah.
You can blame Renee for that. I think early on in the piece, with all of the constant changing of the messages and all of the uncertainty, was a very, very hard time for our mob, especially for our elders. Our elders suffered in silence. They pretty much went into hibernation, in fear of catching COVID. They wouldn't go out to shops. They were too scared to see family and friends, and they weren't able to access medical services like they used to, which is another thing. Technology is very foreign for our people. We don't all have fancy phones and computers, access to the internet. So being told that you've now got to stop going to the doctors face-to-face and do it virtually was really tough. Going to our medical services isn't just about seeing medical providers. It's more of a community hub. It's about, going there, meeting mob, seeing people, seeing what's happening, and then weren't being able to do that.
And were there challenges to creating those connections? Apart from, as you mentioned, technology and things like that, how do you overcome those?
A lot of our community organisations were going out, visiting the elders, going to their homes, taking food packages, make sure they're okay, which is, the team will tell you a bit about what we set up to help that. Connection to country and continuing culture was, that's a big part of who we are, and not being able to go back home, visiting country during sorry business was probably one of the most devastating things we'd had to go through. Sorry business is more like ceremony and, you know, being able to grieve with community and heal the way that we usually do was really tough.
Thank you so much for sharing. Walter, tell us about the Aboriginal Cultural Response team that you set up.
So I set it up with the team as under the leadership of Sydney Local Health District and AMS Redfern as a small group of Aboriginal staff who worked really hard 7 days a week to provide complex cultural and social support for our patients in our community. The team worked on a range of different strategies for the district and guided the district on things like culturally appropriate communication, our pop-up clinics, testing clinics, and working with our community, and supported our patients and community from the moment they were told that they were positive all the way through to the end of their isolation. And it often involved escalating clinical care, welfare, also talking on behalf of the patient and guiding them through that and navigating through a complex system, which is something new. A lot of the times when people first heard about RPA virtuals, when they're COVID positive, the team worked in collaboration with a number of community organisations, RPA Virtual obviously, Special Health Accommodation, AMS Redfern, the Public Health Unit, and our Sydney Local Health District outbreak management teams. It really demonstrated our ability to provide holistic care to our families, our patients and our community.
And what did you find yourself doing that you never thought you would?
Running around. I think one of the, in terms of what I found myself doing is running around 7 days a week, not going from fixing computer and RPA virtual, then in the community delivering a care package and food hampers to those in need. And it kind of just switched in every hour. I was doing something completely different that I never thought I would be doing before, but it just constantly changed throughout the whole time.
Thank you so much for your work. I know you've got deep ties in the community and it made such a difference to both of you. Alexis, it's just us. Ignore everyone else.
And everyone else that's watching.
Ignore everyone else. What difference does it actually make having Aboriginal staff conducting that initial introduction to the virtual service?
So for our community, it's a big thing. It's about the trust. People have got to understand that we actually are the ones to make that first initial contact. So we got mob talking to mob. We got to also remember the colonisation of this country, the mistrust of government, health services, any organisations like that. So for us to make that initial call was the best thing. We would then get the story. So our background stories would be how many people are in a home, who's sick, who's not sick. We would get that information that community's comfortable to tell us as workers than to tell someone who's not of Aboriginal background. We would then work with them. We would explain what the virtual service is about, so what would happen step by step. But at the same time too, we would be explaining that we link our community with other organisations as well to give that support. So we would work closely with the AMS, a lot of emails back and forth with the nurse Christy down at the AMS with who needs support in the community, vice versa. We also worked quite closely with Ursula, who's up the back there, and Glebe Youth Services and Marrickville Youth Services came on board and were also supporting us to do extra shopping, to give out to community, because we had households where you could not leave, as we cover a wide area. So we cover the whole of the LGA for this district, for the hospital. So we did do a lot of negotiating and talking with other services, other providers to support our community. But at the same time, again, back the trust. Community knew we were the ones that they could call upon. Took a long time for them to accept to ring up and speak to someone in virtual. They didn't feel comfortable to do that at the beginning, so we would be that advocate for them, with whether it be with a doctor, whether it be with a nurse. If someone had upset someone accidentally not realising, we would be still educating the staff. You can't ask those questions. If a community member said they didn't want to talk about something, doesn't mean you keep pushing to ask that get that answer. You just sort of stop, let it go. But then, as Karinya did say as well, the other thing we did have a lot was the IT. So we do have a lot of community elders that are not up with iPhones or anything, and not even know how to use the phone sometimes. So we were giving out phones to community as well, to at least help them with that, and explaining what a Zoom call was. Don't be, they're not ringing and Zooming to look at the house. You can say, this is where I want to sit. You lead that Zoom call. You tell them what you want to do. So, yeah, it was quite important. And we still have a lot of community ringing us now, telling us, letting us know that other family members are testing positive as well. And so it actually works quite well. And I think it's with the AMS and virtual together, I think community's pretty much looked after.
It's incredible. You've created connections that will help, like we spoke about before, that will move on to the next challenge, and the trust that you've created here will continue on past those challenges that you mentioned of technology and togetherness. So you guys are incredible. Well done. Athena, what did it mean for you to be able to work with your community in this way?
First of all, I was just thinking about it. It was the pride for the Aboriginal health workers within the district working together as a team to support our Aboriginal and Torres Strait Islander community, because that's the most empowering thing for myself that came out, was kind of at the top of my head. And to go on from that was just to provide that, like I said in the video, the support that we provided to our community members was, paramount. We were the ones who were on the front line as well, going into, high towers in Redfern and Waterloo to make sure they had their food there, even helping with their medication if it was needed, because some of our people, our elders, they didn't know what to do once their medication ran out. If their Webster pack was empty, we had to make sure that it was refilled. So again, that was that connection with AMS and the doctors, even through virtual as well, to make sure their medication was delivered, basically. And we had a driver who was going out there as well, delivering food, medication and whatever else was needed.
I bet you never thought you'd be coordinating a delivery service.
No, I was actually, at the beginning of it, I was delivering pulse oximeters for the wearables team, so it was a very different experience completely for an Aboriginal health worker.
Incredible. Athena, Karinya, Walter and Alexis, thank you so much. And everyone, please thank this team, the Aboriginal Cultural Support Team, doing incredible work. So, we have another video to show you here, if you want to take a look up to the screen.
The type of clients that access Counterpoint are from diverse backgrounds, so a lot of them have been involved in the corrective services, child protection, being survivors of domestic family violence, survivors of child abuse, as well as a lot of them are homeless, AOD misuse, mental health, chronic health conditions, seeking support in navigating the mainstream system within housing and as well through the health. Counterpoint have an open door policy which supports clients so they don't fall through the cracks.
I've been living in Waterloo since 2009, and the community centre have been helping me through my needs with the health system. The health navigator Shane has been able to point me in the right direction and offer me help with information.
The Health Navigation Program is a non-medical support program for people in the local community, particularly social housing residents who don't have access to health services or don't know how to navigate those services. I provide support to help people find a health service. It might be specialists, it might be a GP, it might be occupational therapists, a whole range of different sorts of health services that people find difficult to find. I also spend quite a lot of time working with teams within SLHD, particularly the chronic health care team, the mental health team, drug and alcohol services, just gently improving pathways and access to those services for people.
With my mental health, I've had it for over 3 decades. It's all something I live with, I have to accept. I wish I didn't have it, but for myself to be safe in the society and be treated like a human being. In Australia, they treat you with dignity, and I feel the doctors have compassion, and with the understanding of the Health Navigator, I've received that compassion. I've received that acceptance in society, even though I'm mentally ill.
So as we've just seen, Shane Brown is the Program Manager for the Waterloo Healthy Living Program, and we're lucky enough to have him here with us today. Shane, please join us. You've worked in the Waterloo community for more than 35 years, not to date you, of course. We had some amazing images there. Can you tell us what was happening at the start of the pandemic in your community?
Sure.
I think
it's on?
Begin.
Yeah.
There we go.
Look, I just want to start by saying that I wanted to acknowledge all the people in the room who had friends or relatives or family who died during COVID. And I know Athena and I worked with a young woman, Aboriginal woman, whose mum died during that time, and her family was very vulnerable, and the fact that her health was poor contributed to the fact that she died. So it was a very sad time for quite a lot of people. But I'll also say that the local community were able to rally around and support each other in the Waterloo community. I think local residents acted as gatekeepers and supporters to get those messages out there that were necessary so that people could find the right support. One of the other things that we did at the time was Cecilia Corey and I, one of the social workers from the dental hospital, we knocked on 230 doors in the high-rise buildings with quite a good reception. But at times people were very suspicious and trust was a big issue. And if you live in social housing, often health interventions feel like you're being, your privacy might be invaded, or that something bad might happen. So it took quite a while to convince some residents that they should get vaccinated. I think the other thing that was happening at the time was that I also think that health staff are very brave working in the environments in those clinics, because we didn't know what was going to happen at the time, so that was fantastic. I lost my
Well, I imagine there was fear for them, not just for the community, but for getting sick themselves. There would have been
that's right. There was a fear
for
everyone.
everyone.
So it was a really brave thing for everyone to do in that context. The other thing that we were able to do at those clinics was do welfare checks, and there are a whole lot of staff from the mental health team, drug and alcohol teams, who actually supported individuals who needed other support. I think the other really big thing was that all of the food security was a major issue for people, and for a lot of us who were still working at the time, we didn't experience the isolation that some people did.
It's true.
People were locked down for a very long time, and it was very difficult. That social isolation for housing residents was very difficult at times, and a lot of staff were on the phone talking to people and reassuring them and making sure they're okay, delivering food packages, and just kind of touching base. So it was really important. I think the other thing was that Counterpoint Community Services provided a really important role in giving and providing information to the community from health. So that was vital.
Shane, thank you so much for everything you've done for your community and for your colleagues. So we've heard about the incredible partnerships here that have been essential to care in our communities, particularly vulnerable communities. So next up, for our fifth group, as we work through this panel of incredible people, I'd like to introduce you to Kylie Willis, who is the Director of Housing in Sydney, South Eastern Sydney and also Northern Sydney Districts, Department of Communities and Justice. Then we'll speak to Michael Shreenan, the Executive Officer of Counterpoint Community Services, Erin Miller, who's the Manager of Priority Populations and Places, and Liz Yeo, CEO of Newtown Neighbourhood Centre. Kylie, people in lower socioeconomic communities were deeply affected, not just by COVID infection, but also the public health measures, as we've just said, completely disconnecting them from their communities. Can you tell us a little bit about the impact of the pandemic and the rules on your communities and your tenants and your residents?
Sure. Look, we manage over 20,000 social housing tenancies across our district, so it does take in Sydney Local Health District. Shane has mentioned it, and we've heard it from other parties as well, that there was a lot of social isolation as a result of the pandemic, trying to keep people safe, but also the fear factor that was there associated with that. Food, therefore, became an issue, particularly when people did need to isolate. Communication was very difficult, particularly in sites where people traditionally don't go to their letterbox. They don't go and read what's in the envelope. So we had to try and develop other ways to communicate with people and get key messages out to people, rather than them just seeing people come out in full PPE and creating that panic. So there was a lot of work done by DCJ, but in particular with Sydney Local Health District, we formed some fantastic relationships and, you know, had daily meetings about ways that we could get into our community and work with them and take some of that fear away and make sure they had all the services and supports that they needed. And that wasn't just our staff on the ground, that was staff based in housing call centres that were doing outbound calls to people to check on their welfare, to make sure they were okay. It was us going out and getting scripts filled on behalf of people and delivering it to them in their homes. So things were very different and still are a lot for a lot of our clients. A lot of our clients still have that fear. They are still socially isolated. Our staff are working incredibly hard now to get into everyone's houses, and we're trying to do that, you know, by May next year. So that's a lot of, 25,000 houses that we want to get into in that period, just to check on people to make sure they're okay and see what other supports are needed.
Of all the work you did between DCJ and Health District, what do you think made the biggest difference to keeping people safe?
I think that collaborative effort, there was not, it wasn't just about what health wanted, it wasn't just what housing wanted, it was doing things together. The incredible work and hours that were put in by all of the health workers through this whole pandemic, but with us, we were working 7 days a week, 24 hours a day, sending SMSs, hand delivering letters out to clients to let them know that there'd been a positive case in their building, encouraging them to get tested. We would encourage our clients, we would door knock, we would get them to go to testing centres, we would encourage them to get vaccinations. We would work with services like Counterpoint to help people navigate how to book in to get that vaccination. The work that we did with health, I think, is what prevented any of our social housing blocks in the Sydney Local Health District going into lockdown. We were extremely close, we know, in a couple of cases, but I think it was that collaborative effort, us working very differently in terms of what would it take for us, what do we need to put in place to prevent that happening? So getting the food out to people, getting fresh food out to people, changing our rubbish delivery, that we had people actually, contractors going and taking the rubbish from people's properties on a daily basis. So I think those things, the relationship with Sydney Local Health District really did make a difference for our social housing clients.
Thank you so much. Another person doing 16 jobs at once. Michael, this takes us well to Counterpoint Community Services. What role did you play in that Redfern Waterloo community when it came to the response to the social housing population?
So, first of all, Luann, thanks for inviting us. It's good that NGOs get recognised as their contribution to the COVID fight. And thank you for that acknowledgement, Shane. I lost my father and my father-in-law to COVID during this period. And it really inspires your work that, what health are doing or did do saved lives. And NGOs played an important part in that role. So when COVID first started, the first thing we did was get people round the table to say we need to have a coordinated response for social housing tenants. And back in that time, the first thing we had to do was convince people that COVID wasn't just a flu. People were, oh, it's just the flu, and there was all these conspiracy theories. So it was about communications and messaging. We even had problems with some government agencies not believing it was anything to do with them. It was just a health problem. They soon learned very quickly it was going to be everybody's problem. Working with the city, we managed to get a newsletter in every social housing house in Sydney to communicate what services were available and what information they needed to know about COVID. We also, with the City of Sydney, managed to set up a food network who distributed thousands and thousands of food meals across the city with key players like Oz Harvest, and etc. And that was fantastic work that happened there. After that, we set up a team called Flexible Response. We decided that what people need during hard times is mates. So our team of 5 community workers set up this team called Flexi Team, and they provided services to people in their house. So that was buddy mate, counselling mate, chores mate, delivery mate. So we were delivering things, we were counselling people, we were helping people with their shopping. And during that period, working with Shane, we discovered people that were living in squalor, we've seen people that were living without electricity, we've seen people that were living without power. So it wasn't just COVID, there was all these other issues going on. As the vaccinating saga rolled out with AZ, we worked with DCG to establish a team called Vax Assist. And Vax Assist was about helping people navigate the booking system and putting out those rumours about why AZ wasn't dangerous. What I would say about that is we have never had so many inquiries in 12 weeks. We helped 2,800 people phone that helpline during that period to navigate the vaccine system. We were on call 24/7. We worked with DCG to develop a plan if there was a high-rise lockdown, and we didn't get there. We managed not to have a lockdown. There was daily outbreaks in Redfern and Waterloo, but the health were on site, housing were on site, and the interventions worked at containing that. The Vax Assist programme also did prize incentives for people once they got the jag, and 900 people declared that they had been vaccinated, and that was fantastic. I remember an old woman phoning me up. She was 80 years old, and she's saying, "This is the best thing that's happened in 2 years. I've never won a prize in my life, and I've won something. You've made my day." I said to her, "What did you win?" We won the Sky Bungee experience. So she gave it to her grandson. But it was good to be able to build that social connection, reach out to people and be there. We managed 2 of 170 community centres that are in New South Wales, and they all did fantastic work. And I think it'd be great if the intensity and the closeness and the collaboration that happened over that period continues beyond COVID to all the other wicked issues we challenge. But I do want to thank Health and DCG for the support.
Thanks for telling us about what the NGOs were doing. It's really important. Erin, what were the unique challenges in outbreak management in social housing, but also in the homeless community, which was largely forgotten? By the media, should I say, not by you.
I've got some notes here because there were so many challenges. Logistically, there was so much for our staff and staff from other agencies to consider, from not only preparedness, but through to notifying people they've got COVID, and also outbreak management. We learnt really quickly early on that we had to work with all of our partners here, but also specialist homelessness services to prepare them for outbreaks at their facilities, where there were lots of people sleeping in the same rooms and using the same facilities. So this meant that we had to help them come up with processes so that they could immediately spring into action once an outbreak occurred in their facility, and ensure that they had all the equipment that they needed. Once outbreaks started to occur, we had to do lots of troubleshooting of lots of issues that would come up along the way. And in some instances, it was really hard to find that community members to tell them they actually tested positive to COVID, especially if they didn't have a phone to receive the results or they didn't have a safe home to isolate in while they were waiting for a result. So this meant we had to do lots of detective work, trying to anticipate people's movements amongst the services so someone could be there when they arrived and tell them that they've got COVID and then immediately support them to isolate. In all of the outbreak situations, they were all different and they needed immediate action. So we often had to spring into action at the same time as we were actually writing the processes and the adapting existing processes, all while we were working in partnership with agencies and also training staff from other agencies and reassuring everybody as well. Outbreaks in boarding houses posed a lot of challenges. They've got shared kitchens, shared bathrooms, shared laundries, and each boarding house was really different. So each time we had to do an assessment to undertake outbreak management that was tailored to that facility. And some boarding houses had excellent managers who were really proactive and really worked closely with our teams, but others had really loose management arrangements, and we sometimes couldn't even get a list of the tenants who lived there, so that was incredibly challenging. In some instances where we unfortunately did have to lock down some premises, they weren't our social housing premises, but there were very vulnerable people living there, we had to really quickly form a 14-day, 24-hour roster of staff to work at those locations, and they had to have experience working with vulnerable people and working with people who are often in a period of significant mental distress. We did this alongside police, and that was really hard as well. Police were fantastic, but they weren't received very well at some of those locations. On top of the challenges for us, the challenges that we had to support the tenants through, particularly the homeless community and the social housing community, were immense, and Kylie and Mike talked through some of those. But a lot of these community members are used to supporting each other. And they got by doing favours for each other and helping each other, and suddenly this wasn't an option. And they had to rely on the formal systems that existed, which they'd often never accessed before. And you can't pay for online shopping with the coins in your pocket that you'd give to your neighbour to go get you some milk. So we had to navigate around that to get milk to those people. Lots of people were disconnected, and isolation and loneliness were touched on by the others, but also the lack of entertainment people had in their homes was something that people talked to us about. Isolation for some of us was easy because we've got Netflix. If you don't have a TV, it's really hard. And also substance use was something that was pretty difficult. People didn't have access to the substances they normally used. They started to withdraw from those substances, and that's really scary when you can't be monitored and supported, so we had to navigate around that. We got there in the end with the support of the community, the feedback that the community gave us, and also working really closely with our partners, and we've learnt so much and made so many friends along the way. Thank you.
Thanks, Erin. And Liz, the Newtown Neighbourhood Centre is so crucial in providing this specialist homeless service, particularly for some very marginalised, vulnerable people. What's your strongest memory of the response to COVID?
Yeah, I will just share one memory that for me reflects a bit of the theme, which is around connection and collaboration, but also around contribution. So there was a day I remember when one of the team came back to the office and she said, "Oh, guess who we saw today, you know, when we were over at the local social housing block?" And I'll obviously use a different name. She said, "Oh, we saw David. You know, remember David? He was on King Street for years. He was a rough sleeper. Our team had been able to assist him to move eventually into social housing." And she said he was so excited to see us when we arrived with all the food hampers from the wonderful Addy Road to distribute around the social housing block. And he said, he's like, "Right, I know where everyone is who I need to carry a box up to them because they won't be able to come down here and get the boxes." And I mentioned that one because to me that was about contribution. That was a social housing resident who'd been for many years a rough sleeper, and he really wanted to make a contribution in this context of COVID. And so the bit I would want to add, because there's a lot I could echo in what people have said, is around the contribution of not just all these amazing professionals in health, the professionals in DCJ, the professionals in our community organisations, but our local community members, our volunteers, you know, our people who said, "I want to step up, what can I do, who can I go and assist?" in this crisis. That was partly what I was quite blown away by, how people wanted to help each other. So maybe just to add in terms of what has already been said around what sort of worked, I think that regular communication was amazing with health, with the health district, with DCJ around what was happening in social housing. And actually, credit here too to the Inner West Council, because there was a great forum of all of the community organisations in the Inner West as well. And being able to share what our different needs and our common needs or concerns were, and being able to back each other to address those was really helpful as well. So, yep, connection, collaboration, and contribution. To me, those were the strong themes out of this response. So I do want a big thanks and acknowledgement, particularly to the health workers, because I think they have carried a lot of the brunt of this. And to the Primary Health Network as well. I think doing outreach into boarding houses for vaccinations, doing the wellness clinics, getting out to meet people where they are. Sometimes we just set up tables out the front of the Newtown Neighbourhood Centre so people had somewhere they could go if they didn't have a phone or they didn't have a computer. So,
talk about adapting. Liz, Aaron, Mark, Kylie, thank you so much for taking part. We're going to take a look at another video.
When COVID first arrived, we expected the battle would be in hospitals and intensive care, but really that has not been the case. And the front line has been in nursing homes in many countries, but particularly in Australia. Having access to care in the facility, this has been really very important. So you can have good quality palliative care, good quality acute care, and good quality subacute care right where you live. And of course, many of these people are very disabled, and accessing clinics and such is just not possible for them. It really is about a team effort. So we have a multidisciplinary team meeting every day where we discuss patients. And I think that combination of skills that we bring together to provide care is really useful.
Dr. Natasha Spalding there. And now we move on to delve deeper into caring for older people in our community and those people with chronic illnesses. We have Professor Ian Caddison here, Senior Staff Specialist, and also, I'm going to read this one word for word, Deputy Director, Aged Healthcare, Rehabilitation, General Medicine, Chronic Care, Disability, Andrology, and Ambulatory Care. Have I missed anything? Hopefully not. Endocrinology, there we go. And Deb Donnelly, the clinical manager of that service. So thank you both for being here. Professor, tell us about a defining moment in the RACF response.
Well, we were watching elsewhere and we knew that there were problems in other countries and around our country, and we were getting ready. And the defining moment was for us, though we'd got our teams planned and the people we needed involved and we were talking to people, was when it happened. So we actually had to go out to the facilities and work there. And we took our team, but the thing about it really was that there were so many other people who needed to be involved to make sure the care was effective on site, not just us. It was, as everyone's been saying, cooperation and collaboration, but it also needed involvement. There was no chance to stand back and say, let them do it. It really needed a whole team approach with care, cooperation and collaboration. And may I make a personal comment? This is my 51st year, though it doesn't look at working in health.
21st, yeah.
And I have been stunned and really proud of the way the community, the health system, and so many other people work together to do things so rapidly, and it was such a real pleasure to be involved in something that was effective.
Well said. Deb, you're a clinical manager of the service, so you're on the ground like the rest of the team in the last 2 years. How has the outbreak response really changed the way that you work with RACF?
Look, I think...
Please do, I'm doing the same.
I think that the organised and collaborative response that health and all of our partner organisations provided gave confidence in the district as the lead agency and in the outbreak management response. I think in conjunction to our outbreak management meetings, of which over Christmas there were many, I mean there are about 5 a day, and those meetings involved a number of agencies, the district, the Primary Health Network, and can I give a big shout out to Dr. Brendan Goodger, who's here somewhere today, who assisted greatly in our response. Pardon me. So, you know, these meetings involved the district executive, the public health unit, the infectious diseases units, the RACF outreach team who provided the most amazing response. I've said infectious diseases, the Age Health Clinical Stream, the Primary Health Network, and the district residential aged care facilities. So I think in our response, we have formed better collaboration with our facilities. I think they trust us now. We provide education. We've gone through their outbreak management planning. We've provided infection prevention and control measures to them. They come to us now more readily for assistance. And I think at the end of the day, we all need to remember that residents in residential aged care facility are part of our community. They are not just people in a nursing home.
So true. Deb, thanks for your insight. Professor, congratulations on 51 years. We've heard so often this morning about the importance of really wrapping services around vulnerable communities and the different needs that different people have. And our next guest will be talking about the particular needs for disability and those with a disability and what they did to help. James Everingham is the Disability Inclusion and Strategy Manager, and Alexis Berry, the Staff Specialist, Specialised Team for Intellectual Disability Sydney, and also for Disability Assessment and Rehabilitation Team for Young People. Thank you both. We're going to take a look first, before I chat to you, at this video about a special booster clinic.
Hello, I'm doing the booster shot for the COVID-19 so that people feel safe around me. If you want to be out and about in the community without hindrance, the vaccine is a good way to go.
I would say that everybody should get in line for the booster shot of the COVID.
Don't you get teary on me, then I'll get teary and it'll be all over. James, people with a disability really have been disproportionately affected by the pandemic. What did that mean for how the district needed to respond to support people with a disability?
Yes, I think Ian in a way stole my thunder a little bit. I think for people with disability, particularly in the first early stages in 2020, I could see what was happening across the world, and I remember pretty early on the concern people with disability had around access to ICUs particularly, and the concern that if hospitals were overwhelmed, there might be a chance that if I had a disability and I had COVID, maybe I wouldn't get into an ICU because I had a disability. And that really struck a lot of us here where, with the lockdowns and things were going okay in 2020, how awful that must feel for someone to have that kind of fear. And very similarly to what a lot of people have said here today in terms of the vulnerability cohorts that they've been supporting. I don't want to go too much into the sort of formality structural stuff. We did a lot of hard work, obviously, in terms of collaboration and pulling structures together, and we had great networks in terms of how we responded to either group homes or people with disability living in their own homes with mum or dad or whomever. I think the thing that strikes me the most around what made it work, and people have reflected on it a little bit, is the willingness of people to actually support and really put their hand up and say, I'm going to be a part of this and I'm going to help out and I'm going to make this work for everyone. I've never been a part of something where everyone has come together like that and actually performed in that way. And I think that's because of the fear and the concern for people with disability and their vulnerabilities, that if they did get COVID, maybe they wouldn't make it. And so that really bandied everyone together. And I think something that really impresses me with Sydney Local Health District, I live quite far away. I base myself at Concord, but I live quite far from the area. And people often ask me, why do you come to work when you live so far away? And it's really because of the reflection of not just our health staff, but our NGOs and our stakeholders in the care that they actually provide. People actually care about what they're doing. And certainly from a personal point of view, I got into healthcare to help people. I didn't get into healthcare thinking, I'm going to be a part of a once-in-a-century pandemic and it'll be a great opportunity. I came into healthcare to help people, particularly vulnerable people. And the thing that really, I suppose, strikes me around what it means in the end of our approach or our response, when we look at the Delta outbreak, particularly, we had incredibly low COVID transmission in our group homes in Sydney. We have an incredibly low mortality rate for people with disability in Australia generally, but particularly in New South Wales. And I think the best way, even though it's very hard to put into words and describe, is around what it means for us as health clinicians, or anyone really that's been involved in the past couple of years. And the thing that sticks out for me probably the most is I took a couple of our infection control nurses out for a breakfast between the Delta and the Omicron wave as a bit of a thank you to all their hard work. So a big shout out to Sandy and Chinwei, who are just remarkable. They would have gone out nearly every day for the last sort of 18 months and visited group homes and really, the backbone of our support network to that sector. And, we said thank you and how proud we were of each other and all that. But it was the feeling associated with it, I think, in terms of we know what we did and what we achieved, I guess. And, I've not been around as long as Ian, but I've been around long enough. And I think for a lot of us, I think Sarah kind of echoed this a little bit as well, even though it didn't feel like it at the time, because obviously really full on and intense, being able to reflect on it now is just an incredibly special thing for healthcare staff in terms of actually reviewing what we've actually done. So I think that's probably something that I'll take out of that for the cohort that we're supporting. Yeah.
Thank you so much, James. Dr. Berry, obviously the district supported access vaccination. What was some of the feedback you got from the community and consumers and patients?
Yeah, sure. So it was amazing feedback. So echoing what everyone else has said, the district was really on the forefoot of developing a response to vaccination for people with disability, which was really welcomed by the community at large and their carers. And it was able to take place because we had existing services on the ground that, as everyone has said, came together across different streams and different services. And as the response matured, we had other teams like the vaccination hubs, the flying squad, the mobile vaccination teams, all come together for a really, one response. And we knew that there was never going to be a one-size-fits-all response for people with disabilities. So in the first instance, it was around making mainstream services accessible. And that was, our team would call patients, we'd find out what they needed, we'd talk to them about, how is it going to work for them to get that vaccination. And sometimes that even involved, our nurses going out and singing songs or, telling jokes to make them able to have that vaccination in that setting. And that was a really important part of our response. We've heard a little bit about the mobile pop-up clinics, but I really can't emphasise enough how important they were about delivering safe and effective healthcare in a setting that was accessible for people with disability and their carers. And, you know, we had some amazing feedback from families who said, you know, my person has failed vaccination at their GP or at another setting, and with everything you've been able to put in place, they've been able to have it, and that was a really valuable thing to be part of. And then, of course, you know, we had the InReach, the home visiting program, and that was only able to take place because of the partnership with the Primary Health Network. And that was absolutely an important facet of being able to deliver care to the most vulnerable who couldn't get out of their homes. And I know we had one family that we called up and said, okay, we can offer you this service. And the mum just, you know, broke out in tears saying, I never thought I was going to get my person vaccinated, and you've just enabled it. And that was really special to be a part of. So I think, you know, altogether, as everyone has said, you know, it's really about coming together, working together for, you know, the one purpose. And that was with our disability partners, with our primary healthcare partners, but really most importantly, it was with our families.
Alexis, James, thank you so much for your time. And thank you. Can everyone in the room join me in thanking all of our guests for their insights this morning? It's been incredible to hear from each different sector. Thank you all so much. I understand Renee might have some feedback coming through on slido.com, #community. Renee.
Mic 1, thank you. So I think we're running a few minutes behind, so I'll just pull out one of the comments that we've received on Slido, and that's from Jeff Turnbull, who will be known to many people in the room. And Jeff has offered his thoughts on the learnings from COVID, that people mattered more than things, change is possible, but why does it take a crisis, and equity matters, a focus on marginalised communities.
Fantastic, thanks Renee. Now we arrive at part 2 of our program, which is a panel to talk about why navigating health is better together. And this panel is going to take a look at what good care in the community looks like. Now, as they take to the stage, I'm going to get everyone to stand up and stretch because it's been a little while now. Give them a big round of applause to everyone out the front and also our panellists. So our panel is talking about what good care in the community looks like. Dr. Anthony Brown, the Executive Director of Health Consumers New South Wales. Dr. Brendan Goodger, General Manager, Primary Care Improvement, Central and Eastern Sydney Primary Health Network. Professor Nick Goodwin, Director, Central Coast Research Institute for Integrated Care. Jemima Isbester, Senior Peer Support Worker at Sydney Local Health District, and also Professor Sue Wolfenden, Director, Community Paediatrics at Sydney Local Health District. Sue, we'll start with you. Why is providing care in the community so important?
Well, thanks for asking. I think from everything, and thank you, I just want to say a big thank you for all the speakers just then. That was just an extraordinary session, and I think it has well and truly illustrated why working with community is going to be fundamental to our COVID recovery. I think we've shown we haven't cared for country. I think we need to think about climate change. I think we need to think about how we're going to approach reconciliation to actually make it really meaningful and embrace the Uluru Statement from the Heart. And I think they are all really important in how we minimise adverse events for children. I've got to do it from a ComPeds kind of point of view, and make it make positive environments for children. And we can only do that by working with community and the strengths of the community. And the COVID response has shown that we can actually do it. And it's not something that's nice to do, it's actually an emergency. We've shown huge improvements in child health globally over the last 100 years. Kids aren't dying of sort of infectious diseases anymore. Our mortality rates are going right down, but we've got 250 million children in the world who are not meeting their developmental goals. In Sydney Local Health District, it's between a fifth to a third of children turn up to school without the growth, development, behaviour, skills that they need to really flourish, and that's just going to get worse. That's unfairly burdened by our priority populations, so our Aboriginal families, our culturally and linguistically diverse families, and our families who live with mental health issues and intellectual disabilities. So we've got to think about how we're going to do that, and we can't do that without working with community, and particularly working with our community of children and young people, because that's going to have long-term adverse effects. It's bad for our country from an economic thing, but most importantly, it's bad for all our future generations. And so we've got to make sure that at a population, patient level, you know, value for care, and actually for all of us to continue to have really sort of meaningful work that we really fundamentally base our services within the community.
Thank you. Nick, tell us a bit about your experience and what you think the fundamentals of good care in the community look like.
Thanks. So, again, a pleasure to be here, slightly humbled by all of the conversations.
That's incredible.
And actually, there is one of your answers. And the answer is, in a community, you've got to do whatever it takes in order to be able to support people within those communities and build trust and partnerships. If you take a little bit step back to that, we've kind of known what we need to do in communities for a very long time. And when you look to a number of the documentations that talk about health as a human right, it will talk about the ability of a health service, if we take that perspective, to be able to provide first contact care, to be able to provide a range of services that provide continuity of care across the life course to a community that you know implicitly. And not only that, but you are able to coordinate that care effectively across the range of different health, social care, NGO and other providers. So this type of recipe for how a health and care system should be able to respond with the community, I think is pretty well known. As our knowledge has grown, of course, we recognise that we can't do that without really having a trusted and active relationship with the community. And too often our systems become incredibly fragmented, and we treat our community as if there are items of production, whether they're disease-based production or a particular cohort or your particular funding stream that you're allowed. And this kind of fragmentation always gets in the way of better quality of care to the people who need that care the most. So the people who are, and that leads to the health inequalities that you see. So as we begin to understand that, the systems around the world that are creating a much more beneficial response are those that are working hand in glove with their communities, which reflects the point made before. And if we're going to do that effectively, the health system has to get out of the way of it. So it has to recognize it's only 10% of the solution. And we have to recognize if we're really going to improve the health and well-being prospects of our community, we have to do something differently. And I'm sure Anthony will mention a number of different things, but we need to have activated communities. We need to have communities with the resilience to cope. And we need to be able to provide a platform where actually the community is the driver behind the health and well-being statistics and outcomes that it creates. And when you're listening to all of these different stories, it's all talking about collaboration and cooperation and communication and trust and how we build those types of relationships. And if you don't do that, the likelihood of the community being able to respond to the sorts of things that we might be asking of it to improve health and well-being, you're just not going to reach. So those are the things that you learn, but actually very difficult to create. And I go back to the point that was made in the Slido comment. Why did it take a crisis for us to have these conversations today? Why does it take drought or flood or communicable diseases or an epidemic, these sorts of things? Why does it take that? Because we've known about these things for 40, 50 years. So I'm absolutely inspired by all of these stories. But if this thing is going to last, how do we capture the newfound collaborative culture that is emanating from these different services and find a way to put that into the mainstream?
Well said. Jemima, from a peer perspective, what does good care look like for consumers?
It's about, obviously, fundamentally, care in the community is a human right. being able to live in your own home, and someone with a mental health issue, being able to live in your own home in a community of your choice is absolutely essential. But I think, number one, and it sounds like a really obvious and boring thing to say, listen to us and our opinion about what we want, and listen to our families and to the people, and to our, not only our biological families, but our logical families, the people that we've built around us that make sense to us, that care about us, that are part of our lives. When you're having a care review, ask yourself, why isn't the person we're talking about actually in the room? Because we're the ones that know what's needed. So it's important, the thing about that's important to community care is actually involving consumers and carers in the community at all levels of the health service, and peer support is part of that. But I think it needs to go beyond that in creating what you were talking about, a robust and active community, a community that's involved at all levels of providing the health service, but as well as evaluating it and understanding if we're doing the right work. We need to fully involve community and not just listen to them, but take actions on what they say. So when we're doing co-design, don't just take our opinion and actually do it, because we do know what we need.
Well said. Building on those insights from Jemima, Anthony, at a system level, what does good integrated care look like?
Well, I think I used to say that it looks like seamless care for consumers, that people can move through health system and systems seamlessly. But I realise that I think it needs a bit more than that, and that we've got a long way to go before that's what people experience. So I think I endorse everything that everybody else has said, and I suppose I also want to acknowledge a couple of things. Firstly, I echo Shane's sentiments and acknowledge the people who have died from COVID. And I also want to acknowledge that at Health Consumers New South Wales over the past couple of years, we have taken on a role of commenting on where we saw the gaps and what the concerns people had during the pandemic, but that's always prefaced by the gratitude and acknowledgement of the hard work of the people working in the system. So on behalf of our members at Health Consumers New South Wales, a very sincere thank you. So at a systems level, it is really about, how can we, do all these things of linking up. I think recognising that there is a messiness in working with people and communities and people with complex needs, people with intersectional needs, and that we have to have structures that deal with that, that we have people in the system who are actually allowed and rewarded for working across what are their normal boundaries and feeling comfortable linking up with community organisations, partnering with NGOs, so that it's not just, that partnerships aren't just formal MOUs, but that they're actual real, genuine relationships between the people who work in these different organisations, and that some of those boundaries between organisations and also within health become much more porous. So I don't know if that, I hope that doesn't sound like just a series of motherhood statements, but also the important work of actually looking at how can we connect people and provide that navigation and coordination experience. People who do that, because at its heart, this is about relationships. This is about trust. And I love Liz's comment about connection, collaboration, contribution. That needs to happen obviously at a system level, but also at a local, at an individual level. and recognise that people often people in communities need to be part of the solutions in their own care here.
Thank you. Moving to Brendan with a primary care perspective, what are the fundamental elements of great care and providing even excellent care in the community?
Look, thank you for that. And I know the election's over, but I do have my 10 points, all right? Look, you know, fundamentally it's about maintaining the emphasis on good care. And I guess my first top tip would be around get to know your primary health network. If you see a gap, if you see an opportunity, let us know, because we've got some Commonwealth funding, all right? Hint, all right? So let us know, and we're really happy to collaborate. Really happy to try and solve some of those slightly more wicked problems that you're all trying to deal with, all right? First top tip. The second thing I think would be to say, we know that good health is not distributed equally in our community. We know that. So adopting an equity approach means that people get access to the care that they truly need. So that's got to be absolutely fundamental. And again, the third thing is around about working with the community, working with the person, putting them front of centre. There can be no arguments with that. We've got to focus on equity, we've got to focus on people, and we've got to focus on community and family. That's what's got to be the centre of all that we must do. I'd also say too that we shouldn't shy away from using those wonderful innovations that have come through COVID. Telehealth. We've had My Health Record around for a bit, but I'd say to practitioners out there, use My Health Record. Really embrace some of those new wonderful digital health technologies where you can, because they streamline things, they help in the integration of care. And also around workforce. You know, we've got an amazing workforce, and I'm humbled here today by all the comments, but let's use our workforce better. Let's leverage on what we've learned from COVID. Let's use them to their fullest capacity. Let's trust our workforce. Let's develop our workforce. Let's really train them and let them off the leash so they can go and do all their good work. And I think our workforce is pretty amazing. So again, really invest in the workforce. And at the heart of, and I think what we're all saying today is what the heart of it is around our relationships with each other. You know, to get things done, you do it on the basis of relationships. The phone call or the text message saying, Brendan, can you do so-and-so? Or Deb, can you do so-and-so? And the answer is, yes, we can do that. Or here's how we can navigate through a funding problem. For me, the essence of providing excellent care in the community is around the problem solving. Collectively as a team, working through those bureaucratic barriers, overcoming the obstacles and achieving. Look, and also the focus on quality improvement, and we shouldn't shy away from data and quality improvement. We should always aspire to be better, to use the best data that we've got to drive things forward. To have a restless mind in some respects is actually a good thing. To not accept the status quo, to always challenge, what can we do better? What systems do we need to do better? So it's important, I think, to be aspirational, to push yourself forward. And I can see that in COVID, and what I want is for the legacy of COVID is for it to be that we continue to push, chart new territories, chart new relationships. You know, Nick has, I think, mentioned the issue around integration, coordination of care. You know, the system is really complex. It is incredibly disconnected. I think of aged care, where it's incredibly disconnected in some respects from different parts of it. So part of our role today, let's all take the pledge, it's around trying to build that bridge, all right? Build that bridge to good quality care so everyone gets access. And I think that's what we've got to commit to today. Building that bridge so all of us work together to empower the communities, to empower people. So that's what I think is the essence of excellent care.
Brendan, well said, and that does move us on to what we're talking about next, which is the big, bright ideas. Now, being a radio journalist, I'd love to do a conversation hour with each of you, but you're going to get a 25-second grab. What do you think we can do next? Where do we go from here? What is our big, bright future?
Our big, bright future is, yes, have equity at the centre and address it through strengths-based approaches, working with community.
Love it. Jemima?
I echo what you say, and I think it's about widening the perception of normal and making sure that all the health staff are on board with that and understanding that we're all bringing something amazing to the world, and maybe that doesn't look the same as you're amazing, but it's still important and it's still valuable, and it's something that is really important to your health, is being seen as being a valuable community member.
Nick, where do we go from here?
I think it's a significant commitment to invest in primary community and care services that directly work with local communities in order to address the health and wellbeing needs directly.
Brendan, we heard your thoughts on where we're going forward. Anthony?
We involve patients and service users in the design and the discussions of where we're going forward. And we've got amazing consumer representatives and who are already involved. They're there, they want to be more involved in these discussions, and remember that they're part of the workforce we've already got that we can draw on, we can build their capacity, and we can hear their ideas and experiences.
Can you please thank our panellists, Dr. Anthony Brown, Dr. Brendan Goodger, Professor Nick Goodwin, Jemima Isbester, and Dr. Sue Wolfenden. Now, in a moment, we'll head back to our guests on the floor. We'll continue this conversation talking about ideas for a bright future, but first, take a look at this.
My hope for the future is to provide continuous support for Aboriginal and Torres Strait Islander people to improve their health and well-being.
That we incorporate our learnings and skills developed through COVID into our business as usual practices.
We change the way we think about our own health. It needs to be our number one priority, and we need to take medical advice only from the experts. We need to have a greater focus on prevention and ensure we take all the necessary measures to ensure that we stay safe and protected at all times.
Our culture support workers can be utilised across many health topics, regardless of whether we're in pandemic mode or not, so that we can serve our culturally and linguistically diverse communities.
Is that we really build on this connection and engagement with boarding house tenants and their managers, and we use this connection to really create a much better access for boarding house tenants to good healthcare going forward.
We can navigate through the phase of living with COVID without causing excessive burden to the healthcare system, where our hospitals and staff are exhausted.
Continue to work closely with our communities and provide good services that speak their languages.
Is that we incorporate the lessons learned from the COVID response and that we work in partnership towards an integrated approach to healthcare.
Virtual care can keep growing, become larger and fill in a lot of the gaps in the healthcare system.
Would be to continue to have this flexibility and this collaboration between community centres and health districts in general, and to continue to be able to, deliver a wide variety of services with other allied health professionals in different settings.
That we continue to build our resilience, but with both compassion and continued empathy.
That telehealth continues to be an option available for speech pathology services to offer.
My hope for the future is no more COVID, so that I can travel around the world again.
We use these new relationships that we've made throughout the pandemic to provide better integrated care moving forwards.
For us to keep our communities most vulnerable in mind, it's been nice to be back on the ground in my usual role in community mental health.
Continue supporting consumers, to see more peer support workers employed in health, and to spend more time with my dog.
From that challenge, there's an opportunity for growth and learning and development, and I'm excited to see where we take our current services in the future.
My hope for the future is that we have a healthcare system that can adequately cope with adversity, adequately staffed and adequately resourced.
With current and future improved vaccinations, we are able to live with less restrictions with this virus, and so we can continue to support our ageing population.
We as health workers can gather together in groups with our colleagues and have a Christmas party.
Bring on Christmas parties again. Now we arrive at part 3 of our Care in the Community Forum, and it's about continuing the conversation, ideas for a bright future. So with the lessons that we've learned through the pandemic, And also here this morning, how are we and how should we be thinking differently about health and caring? To tackle those big questions, I'm back on the floor with our amazing experts. Shireen Martin is the Director of Integrated Care. Shireen, what are your thoughts following all of these incredible conversations we've had this morning? Let me help you there. There we go.
Thank
Perfect.
you.
That's all right.
Thank you so much. So I think we need to continue to build on the foundations that we have. We need to build on the foundations that we have. That we, as the ministry, work to resolve those system bureaucracies and impediments that impact on truly delivering integrated care in a wraparound, sorry, I'm a bit nervous obviously.
It's okay, you're doing great.
Wraparound care. Things like resolving legislation issues that support data sharing to enable us to do that better in the community. That we embrace partnerships with our patients and our community, with public, private research and other government agencies so that we can truly develop and co-design service delivery that impacts on outcomes for our population. And that we successfully implement the one system mindset through the joint statement with the ministry and the PHN partners, and that we continue to innovate but balance with what needs to be consistent so that we can provide equity for the system.
Wonderful. Thank you so much. We're after a message of hope, so I'm going to return to Dr. Farinya Dibb from Lakemba Community. What are you going to take from this into the future? Yeah, sure, please.
The collaboration between the community organisations and all of those that were involved during the COVID pandemic resonated unity and inclusion and a holistic approach. And what I'd like to see moving forward is that the strategies that were developed by the Community Leaders Forum, that was led by Dr. Teresa Anderson, can be used moving forward to improve the way that we tackle any future health crisis. And the most important thing that from a medical perspective was we were given the opportunity, and it was humbling to be able to empower and enable the community to make informed decisions. So we were able to give them the power, and very much so during the pandemic, we demonstrated the power of the community and that we are stronger together.
Well said. Barbara Louisi, as you return to business to usual, how are you thinking differently about what CALD does?
I think for me, certainly it reaffirmed the centrality of the community in formulating a response, and I think people these days call it co-design, but really in working together. But also the importance of adopting what I think of as sort of a bit of a hyper-local approach, so creating relationships, and we've heard the importance of that, relationships and networks at a very, very local level with the communities that live in that space. I think that's something that I'll take away in my work with culturally and linguistically diverse communities moving forward.
Thank you so much. Diana Jaggers, you are the General Manager of Community Health. What is the hope for your team? I know you've spoken to them about this.
Yeah, look, I think they're really optimistic. They're really keen to get back to face-to-face care and really look at what the needs of the community are. And I think being here today, it's really inspiring to see all the conversations that have been happening, and keeping those going is really, really important as we develop our plans moving forward.
Thank you so much. Lisa Parsi is the Director of Integration and Partnerships and Director of Today, pretty much, along with Lisa. What opportunities has the response highlighted, and what plans are underway in Sydney Local Health District to harness this into the future?
Look, as Diana said, it's been so inspiring and reassuring to hear from all of the speakers here today from a range of experiences and expertise, to know that we're on the right track. And knowing the theory of what we do and having that put to the test during COVID has been an experience like no other. And I think the opportunities that we take from that are to continue to listen to our community, to hear what they have to say, they know what they need. It may not be an expensive scan, it may not be surgery, it might be heating in their house, it might be a few dollars to help them pay a bill, it might be a lift to the GP, or it might be a new GP, and we need to really listen to that. I'm really excited to be able to help build the research capacity to evaluate what we do, to evaluate the care in the community that we provide. And I'm also, just in my portfolio, we have lots of plans to address some of the factors that were raised here today, both in terms of developing new pathways to primary care with some of our very marginalised communities, and also the pathways to specialist care. I know that we've got a new role that you've seen Paul Clenahan working in a new role in homelessness and boarding houses, and we've seen how vulnerable those communities are. So to have a dedicated focus in that space is really critical. We've got Shane is doing a fantastic program looking at building capacity within people who live in high-rise social housing to develop peer education programs. So again, listening to the community and making them, helping raise their voice that they can be a part of the solution where they have the answers. I'm excited to be working with Brendan in the PHN to co-commission services that bring new ways of delivering primary care within communities of high locational disadvantage. So it's great to hear that we're on the right track and that we need to keep listening to our community.
Lisa, thank you so much. Dr. Jackie Small has just been named President of the Royal Australasian College of Physicians. She's a Senior Staff Specialist and Team Leader for the Disability Specialist Unit and Clinical Lead for the Specialised Team for Intellectual Disability, STRIDES. Jackie, what are the key lessons we need to learn from our outbreak management teams, and how do we sustain those learnings?
Firstly, I want to thank the district's leadership and my colleagues for supporting me in my new role at the college. But I think that the district has a lot to be proud of, particularly in relation to the care of people with intellectual disability. And we've seen that through COVID, but also through business as usual. At a national level, the Disability Royal Commission and the federally led process to implement the National Roadmap to improve the health of people with intellectual disability have highlighted both the poor health outcomes and the shortened lifespan, but also the ways we need to make a difference. New models of care, including people with intellectual disability, educating our health professionals, and I think that's really business as usual in this health district. So we've already got a lot to be proud of, and in fact, the STRIDES model has been described within the National Roadmap. So the activities we're delivering here already feature at that national level. But I think that what we need to do is both continue to recognise the needs of people with intellectual disability that have been amplified through COVID, continue the response of whatever it takes to support the health needs of people with intellectual disability alongside other vulnerable populations. And that's been particularly important in relation to vaccination. We know vaccination and other preventative health care is neglected for people with intellectual disability. But going forward, there are some national leadership opportunities, and I really think this district is well placed to respond to some of those. There's to be a National Centre of Excellence in intellectual disability that will be established, and it would be really exciting if we could partner with other organisations. There's also a substantial amount of research money that is to be hopefully delivered by the government. They made a commitment during the election. So I think those and other initiatives and amplifying our experiences of integrated care will be a major contributor to wider sector responses to embed those in the healthcare of people with intellectual disability. Thank you.
Jackie, thank you so much. And can everyone give a big round of applause to all of our contributors today? Okay, as this morning's event draws to a close, I'd just like to invite one more guest to the stage, Professor Christine Giles, Deputy Chair of the District Board and Chair of the Research and Education Committee. Professor, thanks for your time.
Like others have said, I am both humbled and moved by the commitment and the energies and efforts of the staff of Sydney Local Health District. And on behalf of the board, I'd like to thank everyone for what's been an amazing effort. I'd also like to, in closing this session, thank everyone for their contribution this morning and ask Luanne Blunden to join me on the stage in thanking two particular people, Renee Morton and Lisa Parsi, who have been instrumental in putting together today's showcase.
I'd like to ask Lisa and Renee to come up on the stage. As I think it was Renee and Lisa had said the other day to me, it takes just as long to plan an hour and a half, 2 hours, as it does a week of programs. So I have to say I'm incredibly proud of not just these two people who work for me, but my entire team. I'm incredibly proud of Sydney Local Health District, and I'm incredibly proud of our community. What amazing community, and I'm part of the community. I'm a Bankstown girl, so I'm sort of out of this whatever, but originally a Bankstown girl. And, you know, I thought I knew the community, but not until now have I actually learned so much about you. So much about our NGOs, so much about other people that volunteer. It is just, and I know I've used the word amazing so many times, but I'm incredibly humbled. And I know that I talk for the executive to say thank you so much for all that our health partners have done for us. DCJ, the ministry, everyone that has contributed. It's almost like a debriefing, isn't it, being through a trauma that you have to think back and think, what did I gain from this? But personally, I just gained a realisation that we cannot do things individually. We all know this. Nick said, we've known this for years, about how much our community can do. We need to let our community lead us and educate us. And we've started that with Dr. Teresa Anderson meeting regularly with our community leaders. It's not just an annual event now or a biannual event. It's going to be a regular event where we listen and learn from all of you. And I do want to say, please don't leave us. Stay with us, grow with us. And these are our future. They're leaders now, but they will be our future leaders as well. So thank you so much, Renee and everyone. And Corinne and Teresa Anderson, who had the courage and the innovative ideas all the way through the 2 years that we've experienced. And without that courage, and our embarking on new things we had never done before. I went to the airport, and some of the nurses here will... I was telling people how they need to stand behind the line. I bossed pilots around. It was so good, let me tell you. And I can tell you which airlines were the most cooperative for physical distancing. But so much, thank you very much. And I hope all of you enjoyed today. It was a bit of an experiment with the people talking. And sharing what they had experienced, but I hope you all enjoyed it. And a big plug for community health workers, Liz Harris and Professor Harris. We need more community health workers, peer navigators and peer workers. Thank you very much.
Thank you, Luanne. And I'd also like you to join with me in thanking Natalie Peters for her wonderful effort this morning. It goes without saying, but it's important to say that the work that everyone is doing is so important. I think what I have seen this morning is that the joint efforts have resulted in a more inclusive community, a stronger community, and has built resilience and hope that we will be able to continue to build and grow together into the future. The presenters who spoke today have shown us the enormous capacity of the staff working in the Sydney Local Health District and the strength that comes from when we work in partnership with others and the results that we can achieve from that. I think the session for me demonstrated the importance of outreach and how much we can achieve when we provide care with kindness, with empathy, with generosity, and with skill. It has been truly impressive. In closing, I would just like to say to Teresa Anderson, thank you for your leadership. The board is grateful for the courage and the capability and the drive that you show to make sure that the region is the best the district, is the best that it possibly can be. And to say to all of you, we look forward to seeing you next year in the same place at the same time, and to hearing again of your achievements, and we wish you well. Thank you very much, everyone.